So, hello everyone. I'm Resham, journalist at IHW TV. Welcome to the Rabies Awareness series on World Zoonoses Day, an initiative of the IHW Council supported by Zydus Life Sciences Limited under the Viram Full Stop on Rabies campaign. So, rabies is a vaccine, preventable viral disease present in more than 150 countries and territories, with India being endemic and accounting for 36% of the world's rabies deaths. We are gathered here on the 17th World Zoonoses Day, commemorating the historic event of the Louis Pasteur's first dose of the rabies vaccine to address rabies in India. So, for discussing this, we have eminent panelists today who are experts in the field of rabies. So, let me introduce our panelists. Firstly, we have Dr. Anurag Agarwal, who's the founder secretary of Consortium Against Rabies. Then we have Dr. Ravish, HS, professor of Community Medicine, KIMS, Bangalore, and Secretary General, APCRI. Then we have with us Dr. M. Sai Surendar, who's the Vice President of Society for Emergency Medicine India, SEMI. Then we are joined with Dr. S. Mohammad Salim Khan, who's the Professor and Head Department of Community Medicine, Government Medical College, Srinagar. Then we have been joined by Dr. Asis Manna, who's the Professor and Head Department of Microbiology, Murshidabad Medical College and Hospital, former MSVP, ID and BG Hospital, Kolkata. So before starting with this insightful discussion, I would like to present few data points here which are very necessary to talk about. Firstly, do you know that rabies causes an estimated 18,000 to 20,000 deaths annually in India, though the true numbers are actually higher? Then do you know that rabies deaths are 100% preventable with prompt and complete post-exposure prophylaxis? Then about 30 to 60% of rabies cases and deaths in India occur in children under 15, often because bites go unrecognized and unreported. Then dogs contribute up to 99% of all human rabies transmission. So do you know that even with the medical advancement, there is no treatment for rabies? So with that, we would like to begin the discussion with Dr. Anurag Agarwal. So firstly, thank you, Doctor, for being a part of the segment. So the first thing that I would like to put across and ask you is, can you please highlight in brief about rabies? Like, what are the key steps our audiences, including doctors, parents, and children, should know to protect themselves from this deadly disease?
Yeah, good evening and thank you for having me on this panel. So, as you have already mentioned that rabies is a deadly disease. Once you have it, you have had it. There is no chance of survival and it is nearly 100% mortality. Now, this disease, as we all know, is transmitted from bites of mammals. So, dogs are the main culprit. 96% of cases of rabies are caused by dog bites. The remaining 4% are caused by bites from cats, monkeys, wildlife, and other sources. So the main culprit is dog. So now you wanted to know what are the key steps our audience, including doctors, parents, and children should know so that they are able to protect themselves from this disease. So number one, as a general layman who's walking on the road, we have to be very careful and know how to protect ourselves from the dogs. So there are some basic steps which we need to take. Number one is whenever you see a dog barking, do not try and run away from him. He will definitely chase you and try to bite you. You are on a cycle or a bike and the dog is barking and approaching you. Don't speed, because if you try and speed, he will pounce on your leg and you will definitely be bitten. You see a flock of dogs standing somewhere and barking, don't go towards the dogs. Try and move away from the dogs. If you go towards them, they will certainly start barking at you and they will move towards you menacingly and you will have a high chance of getting bitten. Other than that, do not try and throw stones or use sticks to frighten off dogs, because next time that same dog will come from behind and bite you. Because a dog is able to recognize and relate to previous past experiences, especially if they are bad experiences. Then if you are bitten by any chance, the best way is wash your wound. So washing of wound is extremely important because it kills off more than 90% of the virus. The virus is, the coat of the virus is lipophilic. that means that it is easily dissolved by soap. So wash your wound with soap and water immediately after a bite, and then report to a doctor as soon as possible. So this is what as an adult we can do. Now coming to children, again we need to sensitize them regarding dog bites. So children are very much more inquisitive. They will go and try to pull the ear of the dog or pull the tail of the dog. Some kids go and want to sit on the top of the dog. The dog can get irritated and bite you. Other than that, there are strays on the streets. Children again find them interesting. They go towards those dogs. And sometimes there are kids who are pelting stones at dogs just to irritate the dog. So if the dog is irritated, it can come and bite you. Then pups are there on the road. Some kids go and handle the pups. The mother can suddenly become aggressive, and the female dog will come and bite you. So children need to be told that, see, this is a place wherein you cannot go and play with every dog on the street. Other than that, if they are bitten, they have to be told that they have to report to you as a parent, and then you have to again wash the wound and take them to a doctor. Having said all this, another important point is for those families who have pets, get your pets immunized regularly year after year and take pre-exposure prophylaxis. In fact, all of us who are surrounded by dogs, see, any person who goes down the road, goes to workplaces surrounded by stray dogs or street dogs or community dogs, whatever you want to call them. So we are surrounded by dogs, and the safest method for us presently is that we take pre-exposure prophylaxis. That is, we take the vaccine before being bitten by the dog. So if you are bitten later on, you will not require a lot of treatments, and there's a bright chance that you will be saved from rabies. I think we'll discuss this as we go down the presentation. Thank you so much.
Okay. So with that, Dr. Anurag, would you just tell us, like, you said that what should be the doctor's role in this? Like, if he's come across a patient who has got a dog bite, then what is the first step that the doctor should go for or should take?
So, as a clinician, every doctor should know how to manage dog bites. The incidence of dog bite is around 2.5% annually. So, there is no doctor who can claim to say that I have never seen a case of dog bite in this country. Every doctor, be him a surgeon, be him a neurologist, be him a nephrologist, or any specialty, will have always faced dog bite in his family or in his patients. So, he should know the ideal treatment of dog bite. And the first step is wound washing, that is, washing wound with soap and water. And the next step is then categorizing the wound. That is, if there is even a drop of blood, the patient requires immunoglobulins into the wound, and of course, completing the course of vaccine. So every doctor, every healthcare worker, every nursing staff, every public health nurse, any person who's working in any health setup should know the basic management of animal bite.
With that, coming to Dr. Manna, so Doctor, could you highlight some key initiatives the government has taken in the recent years to curtail rabies?
Definitely. Uh, I just want to add one sentence to Dr. Agarwal's deliberation that uh, please, please tell our juniors that if you are accidentally or incidentally exposed to some animal bite or wound, don't hide it. Children have a tendency to hide wounds, and thereby they can be a victim of rabies. That is one important point we should tell our children. Now, coming to the question, uh, government is definitely concerned, especially thanks to the efforts of APCRI, that is Association of Prevention and Control of Rabies in India. Dr. Agarwal is leading that, and there are some important members. I have one senior colleague, Dr. Poddar over Kolkata, Dr. Sumit Poddar, he is now the president, and NRCP, that is National Rabies Control Program. It has been implemented in the 12th 5-year plan, that is about 2013. Before that, government has one set up, but impetus has been given from that period, thereby ensuring proper management of animal care bite victims, animal bite or animal exposure victims. This is very important because unless, as Dr. Agarwal has already said, that the wound is washed properly, running water for 15 minutes with a hard soap, that is detergent like soap, because the virus is fat coated, lipid coated. It should attack. Don't use the usual soft soap we use. You may use the detergent bars, what we use for washing the clothes. And another point is ensuring the supply of vaccines and immunoglobulins. This is very important. Every hospital, especially in our state, is now utilizing intradermal route for vaccines. It implies that it triggers the already short supply of vaccines. That is, with one intramuscular dose, that is 1 milliliter, I can vaccinate 5 persons with 2 doses of intradermal at different sites. That is, we can save 5 persons. Another thing is very important, that is proper reporting of both animal bite victim cases as well as the suspected rabies cases. The next important point in NRCP is surveillance of human rabies cases. There are many times when we have seen that due to lack of diagnostic services, there was suspected diagnosis of rabies, and we all know rabies is fatal. So the healthcare workers may sometimes neglect those patients. That is why the diagnostic procedures are to be implemented for all suspected rabies cases, and definitely we can then know the true burden of the cases nationwide as well as regional wise. Another thing is the care of rabies patients. This is a new thing which has been acclaimed by some persons from APCRI, and it has been definitely emphasized that though we can't save the patients, we can make the last minutes or last hours or last days of him or her better and human. This is very important. So not only the prevention, but also the care of the patients is also important, as this is very much human in nature. Rabies has been set up. The first batch has been trained in NCDC Delhi, and then another batch has been trained in Nimhans. Nimhans. Then there are setting up of regional rabies diagnostic laboratory. I have the opportunity to work with my colleagues, Dr. Kia Mukherjee and Dr. Soma Sarkar. They have been very meticulous about establishing this regional rabies diagnostic laboratory in Beleghata ID Hospital, Kolkata. This serves the eastern region, and the samples are now coming. Awareness generation, what is being done today, is very much important factor for NRCP. Research is very much important over this, because new dimensions are coming in both prevention as well as some part of the treatment of rabies cases. For prevention, passive immunity is becoming better and more acceptable. This is very important. Already there are some preparations coming in which there is not using immunoglobulin, especially from equine source. That equine source is a point of concern to particularly the private practitioners. They all fear, or they are all apprehensive of some AEF, that is adverse events following immunization after administrations of horse immunoglobulin. That is why those monoclonal antibodies, be it cocktail or monovalent, that have come, that have proved to be very, very less side effect. And definitely that is a very welcome move and welcome attitude to our armamentarium. Another important thing is integrating this NRCP with One Health program by the government. That is why resources from all other associated departments, they have come up, and they are joining the endeavor from education to implementation, everything. So I think these moves by the government, if appropriately taken up by the society and our doctors, definitely this will make the NAPTRI, that is National Action Plan for uh, Elimination of Dog-Mediated Rabies by 2030.
Okay, so we can't deny that there has actually been going a lot to curtail rabies, as rightly pointed out by Dr. Manna. So, with that, if any other panelists would like to add to this, please feel free to do so. Like, highlight some key initiatives taken by the government in the recent years. If any other panelists would like to add something to it.
I'm Salim Khan from GMC Srinagar. We started anti-rabies clinic way back in 2003. Previous to that, we used to give the sample vaccine. Previously, what we used to call पेट में injection लगाना. Then basically it all happened that we saw cases coming up and they were just managed in the hospital dispensary. Then we had a booklet by Dr. M.K. Sudarshan, Dr. Ravish, maybe his boss for all of us. Then we asked our institution to permission to start anti-rabies clinic, and since then we have been managing around 7 to 8,000 animal bite cases annually. Initially, we used to just get around 1 lakh rupees budget for the vaccines, and it has come to 1 crore this time. So the support from the government has definitely helped us, because initially we used to give only 1 dose of intramuscular vaccine and 4 they have to procure from the market. Today we are providing anti-rabies vaccines free of cost, the rabies immunoglobulin free of cost, and as Dr. Manna said, now we have monoclonal antibodies. We have been procuring it not to the full extent, but to some degree over last couple of years. And hopefully, when the budget will start increasing, we will have more of a safer type of antibodies available to these beneficiaries. Another thing what happened recently was that the government of J&K made the notification that rabies is a notifiable disease. And this will definitely help in identifying and notifying the rabies cases, because over these years, we hardly had any data available with us about the number of cases who died because of rabies. With the National Rabies Control Program, though, there were initiatives, but now with the notification, I believe this will definitely help us in identifying the number of cases. So we have a much better data available nationally. Third thing is about the elimination of rabies. If we look at Srinagar, I will talk about Srinagar. We have estimated around 80,000 to 1 lakh dogs in a population of human population around 15 lakhs. So the dog population ratio is quite high. If we look at the recent data that was published about the dog human population, J&K stands at number 2. And the government initiatives are not that positive with regard to that. Talking about Srinagar Municipal Corporation, who are concerned about sterilization of dogs, we hardly see not more than 40 to 50 dogs are sterilized per day. And during winter times, because of cold environment, all those things, the surgical procedures get down quite fast. So these efforts are not definitely going to reduce the dog population. And along with that, another big problem which we are facing, apart from dogs over the last few years, especially post-COVID, is that we are getting good number of cases from people who have cats as pets. Just an example, last year we had our anti-rabies clinic at our GMC Srinagar Associated SMHS Hospital. We had around 8,000 animal bite cases. Out of that, 2,800 were associated with cat exposure. So this is another trend that is coming. Around 30% has come. Initially, it used to be 2 to 3%. So this is again a challenge because we have been telling them that once you have a cat as a pet, please go consult a veterinarian, qualified veterinarian, who should go for their checkup and go for their vaccination. But this trend is going on so fast here. We don't have pet dogs per se so commonly as against now the pet cats. So the awareness we are trying to improve upon people, but it's not to that level. And secondly, with regard to what Dr. Manna said, that One Health approach, we have an MOU with our agriculture university, and even today morning, we visited their faculty of veterinary sciences. We gave the pre-exposure prophylaxis to around 130 students and doctors and technicians there. So we are working on those fronts, but with regard to the dog population control is a big challenge for all of us.
With that, Dr. Sai, you wanted to add something to it, I believe.
Yeah, good evening, everybody. It's a very nice program that's been organized. I represent Society for Emergency Medicine India, which is the largest conglomerate of emergency physicians in India. About more than 4,000 emergency physicians who are working at the forefront of hospital emergency departments who are actively saving lives from rabies. So day in and day out, we've been receiving every emergency department around, say we have about 900 to 1,500 emergency departments which are affiliated to the society, who have a constant number of dog bites and animal bites coming to our emergency departments with different case studies and different types of bites which we see day in and day out. So SEMI has been an association who has been actively promoting to save lives from rabies. And to further support and enhance the efforts, SEMI will be launching several initiatives to raise awareness, to educate and advocate for emergency physicians. One such program is the SEMI mentorship program, where we are certifying emergency physicians on animal bite management and using standardized protocols. And we are trying to bring in a unified or uniform protocol for animal bite management, including wound washing, passive immunization, and active immunization. And we are also conducting regular group discussion meetings in 23 state chapters all over India, where state chapter members will initiate group discussions for case study reviews also. In our annual conference this year, we are planning to launch a SEMI Blue Book, where there will be discussions which are underway to launch the SEMI Blue Book on animal bite management. So we are also actively promoting other societies like Critical Care Society and IME also to, as a nationwide with the help of other stalwarts who are speaking in this webinar, to bring a unified protocol all over India. That's from my side. Thank you. Thank you.
So we can't really deny that SEMI is doing a lot towards this initiative, clearly. So with that, coming back to Dr. Salim, as the professor, HOD Department of Community Medicine, Government Medical College, Srinagar, you have already talked about the initiatives that have been taken by JNK. So could you also talk about some ideas that can be taken to improve the rabies program implementations?
The intersectoral collaboration is quite important. We have seen even once we talk to the veterinarians, they feel handicapped because they don't have facilities for animal birth control. We have one facility at the University of Agriculture Sciences, but hardly they get 2 to 5 dogs per day, hardly. But that is again over summer time. So we need to have more such facilities across the country, especially when there is a ban on culling of dogs. So there is no other option than for sterilization. Once we look, another problem is about the garbage management, waste management, especially the domestic waste management. One of the doctors who is working with the Srinagar Municipal Corporation for Animal Birth Control said that the weight of the dog, even in our population, is around 40 kg. It's so huge. While as in other parts of the country, we see just it's around 15 kg or 20 kg. So the waste available, especially the non-vegetarian waste coming from households, from the restaurant, other eateries, and their unscientific disposal is definitely encouraging dogs to come together and making them more healthy and voracious. And even during evening hours, we see that hundreds of dogs are just getting at a one place where we have dumpers and all those things. So the management of waste from the household level as an individual responsibility, then to the civic body's responsibility is very important in managing the dogs. Because as long as we have these things available for them, so they will definitely have more aggressive nature and have more life span, and that is important. Another thing is about the veterinarians and the government agencies who deal with dogs. We have seen dogs roaming around. Sometimes they are not, unhealthy, they are sick, and they are injured. So we have some animal welfare committees, but their number is quite low. So again, managing such sick dogs is of again an important issue that needs to be taken care of.
Yeah, I think people should consider the ideas and the challenges that you are facing and do something about it. That is surely considered. I'm sure audience are going to gain a lot from this and learn. With that, Dr. Asis Manna, you wanted to say something, add something to it? Your mic is off. If you could just.
I wish one consultant veterinarian should be the panelist in this discussion. However, there is a very important thing regarding the diagnosis of rabies in animals. There has been paradigm shift from what we learned during the student days. That is, sever the uh, head of the died or suspected animal, then in a box packed with ice, send it to the laboratory, and there we dissect from the hippocampus. The material has been taken. It has been very much changed in last few years. That is implementation of field level lateral flow assay. That is a very easy approach. Just by making an incision at the animal's neck and then dislocating the atlanto-occipital joint, uh, straw, straw or the artificial insemination cannula is introduced into the brainstem, and then the sample is taken. And at the same point, you can introduce it in the lateral flow assay, just like your pregnancy kit. Uh, you can use it and tell whether the animal was rabid or not. This is very important diagnostic procedure, and that has helped us to identify the source so that the whole lot of exposure by the same animal is protected by prompt vaccination. This is very important.
Totally, Doctor. Noted. With that, Dr. Ravish, being the Secretary General of APCRI, I would like to know from you that what are the challenges and difficulties in the program implementation you see and witness for achieving our mission of zero by 2030?
Thank you, madam. Even though the government of India has implemented NRCP, and of course we have to laud the efforts put by NCDC, Government of India, to prepare an APRI, that is National Action Plan for Rabies Elimination, and it is going on. There will be challenges everywhere, whatever we implement. So the most important challenges we can expect and we are seeing in the field is one, the most important thing, as it has already been told, the training of healthcare personnel. Because what we have read in our MBBS days and what it is there now, post exposure prophylaxis, basically mostly focusing on that, it's little different. And now the other challenge is if you go to the WHO website, the mode of treatment or the number of doses for intramuscular, intradermal is different, and what the DCJ, Government of India, and NCDC approved is different. So once again, we have to see through that all healthcare physicians who are treating any animal bite cases has to be updated regarding what is the present thing for post-exposure prophylaxis we are supposed to follow in our country. Just for an example, intramuscular vaccination in our country approved is 5 doses. So they are supposed to give all 5 doses to any category 2 or category 3 animal bite cases. That is very important. If the wound is small or bigger, whatever the size of the wound, if it is category 2 or 3, they cannot neglect and tell 1 or 2 injections are enough, 3 are enough. If you go by WHO guidelines, 4 is enough intramuscular, but the Government of India, it is 5 doses of intramuscular and 4 doses of intradermal vaccination is a must. So training is a very important step, which is a challenge. Of course, everywhere training the entire healthcare provisions is a very difficult issue. So that's a challenge with regards to post-exposure prophylaxis. The second most important thing is training is one way. The other way is the policy or the political commitment from the state itself. Because since all of us know that state is health chapter, and each state has to be committed towards rabies elimination in future as early as possible by 2030. That is the goal for us. So as Dr. Salim sir was rightly pointed out, their government has started with 1 lakh, now they are funding 1 crore. So that means that the political commitment by the policymakers. They are the politicians. So political involvement is very important. Even though government or NCDC has made the program, advocacy and adopting and implementing in the respective states is a challenge. You know, in our country, everywhere for any policy implementation, it's a challenge. That's the second challenge. The third one, most important thing is we have to create awareness among the public or in the community. That is also very important because people has to come to the hospital when they know that dog bite is preventable or the rabies is preventable. Then they are supposed to come to the hospital, seek the health. That is most important. As Dr. Manna as well as Dr. Agarwal was telling, the children will neglect and they will hide from their parents. That has to go. Therefore, health education should start from the school level itself. The school curriculum has to contain regarding animal bites, prevention of animal bites, and where they are supposed to take the treatment and what are the three important steps of treatment. Those things has to be known by the community. Therefore, whenever the demand is there, naturally the healthcare personnel will give. Even though some of them, if they know that whenever there is even a small minute amount of bleeding, it is category 3, they will demand for rabies immunoglobulin or rabies monoclonal antibodies. So if the demand comes, naturally the physician has to give. So demand creation is through information or education to the community. So that's a challenge. So each one of us will have to work regarding those challenges. And of course, as sir was already telling with regards to strengthening of laboratory services, surveillance, and all those things, or at the government level. So these things are the challenges which we face in the implementation of National Action Plan for Rabies Elimination. And of course, once again, we should thank the Government of India. They are accelerating this towards the prevention of rabies as well as elimination by 2030. Thank you.
Totally. Being aware, updated, and proper training is definitely a key for being closer to our mission of zero by 2030. With that, Dr. Anurag, would you like to add something to it, like about the challenges, if you could talk about it?
Yeah, am I audible first of all?
Yeah,
Okay.
it's clear.
So, Dr. Ravish is very right that we need to have awareness across the country, from the layman, general public, from teachers to students to health workers. Everybody should know what to do in case of an animal bite. As I had earlier pointed out that we have a very high incidence of dog bite. So everybody will be faced with dog bite in their lives. That is what is expected in our country with the high burden of free roaming dogs around us in the society. And wherever we go, we find dogs. And if you go to places of worship, you will find monkeys. So you are surrounded by monkeys wherever you go to a tourist spot. So spreading awareness, having good quality products available. So even if you are aware, if you do not have a good vaccine or immunoglobulin available, then it is no sense having awareness. So having those things available in the system easily for the public. So being a third world country, we have a large population which is poor and lives in villages. So we need to have resources available free of cost in the rural areas to the last corner of the country, so that whenever there is an exposure to a dog, the correct treatment is available, and the government of India is doing a great job. See, I remember the time when I joined as a doctor, there was no concept of immunoglobulin. Vaccines were in short supply, and everybody used to come with chilies and haldi and cow dung applied to wounds. And over last 20 years, we find that immunoglobulin is available across the country. Most of the government hospitals, vaccine is also available across the country, and the concept of management of animal bite has changed drastically. So all the budgeting, funds, support, and awareness has come ultimately with the pressure from with the political will and support from the government. And of course, there is a concept of One Health. One Health simply means that we want to integrate the animal and the human component together. So you have the ABC program, Animal Birth Control Program, wherein the animals are sterilized and vaccinated and tagged, so that we know that this particular animal has been vaccinated. So all this is going on across the country. Some states are reporting zero rabies over last 2 to 3 years. I'll give you a small example. My campus, my medical college campus, we are undertaking mass dog sterilization and vaccination campaign with the support of Municipal Corporation Delhi. So all the dogs in the campus are being sterilized and vaccinated and collared and microchipped. So all these activities are being done. So the government has the will, is supporting us, and we as clinicians or as people from public health have to come forward and take this program to an extent that we are able to eliminate rabies by 2030, which is our aim of finishing off rabies.
With Dr. Ravish, you have collaborated with the Viram initiative. If you could talk something about that as well,
Yeah.
Dr. Ravish.
With coming to my first point with regards to the training of healthcare professionals, Viram is a good initiative with Zydus and APCRI, and we are definitely doing the initiative with regards to healthcare professionals training on online program which was conducted, and more than 500 doctors were trained with certification, so that each doctor should know what to provide in post exposure prophylaxis in their setup. So that is the usefulness of Viram. Such programs has to be done across the country, and I also request Zydus to continue this program involving other physicians who didn't know or who has not attended this program. So this is very important. When the physicians comes to know exactly what they are supposed to do, definitely it will be useful, and it will lead to elimination of rabies by 2030.
With that, coming back to Dr. Anurag, I just want to know that is the supply of anti-rabies vaccine, that is ARV and HRIG, sufficient in India? Like, what are the challenges we face in ensuring the adequate supply of the same?
So there are multiple manufacturers of the vaccine in the country. I think there are 4 or 5 manufacturing facilities. Once around 5 or 6 years ago, there was a severe shortfall of the vaccine because one of the plants of the manufacturers had undergone maintenance for 1 year. But after that, we have adequate supply of vaccine at this point of time. Uh, yes, we want to have pre-exposure prophylaxis in our program, national program. We want to push it. So if we want to push pre-exposure prophylaxis, we will need to increase our capacity of the vaccine much more. So presently for post-exposure prophylaxis, the supply is still there. But again, if we want to cover nearly all the post-exposure prophylaxis, that is, after animal bite, we want to treat all the patients across the country, we will have to hike up our vaccine supplies, because vaccine supplies are not that big quantity available in our country. Now coming to immunoglobulins. So HRIG, which is human rabies immunoglobulin, is a product which is imported either from Israel or Germany or China, and it is prepared from the serum or blood of humans. So therefore, a minuscule amount is available for use, and it is being used very sparingly across the country. So we have again, because of the ongoing conflict in Israel presently, the supply of HRIG is still further curtailed to the extent that it is now available in very, very small quantities. Now, WHO had thought of this scenario in 2001 itself, that is 24 years ago, and it had formulated a program wherein it wanted to stimulate private labs to come up with antibodies which are specific to rabies virus, so which are known as monoclonal antibodies. And it licensed 2 antibodies from 2 different countries, one from USA and one from Canada. And then they gave it to private manufacturers that okay, you can take these 2 molecules forward, which have been produced by 2 labs in these 2 countries, and then conduct trials on humans and ultimately market a product. And from that, we have now cocktail of monoclonal antibodies available, which is approved by WHO as well as by other organizations like Indian Academy of Pediatrics and Consortium Against Rabies and APCRI. And this product is now available in such a way that because it is artificially made product, it can be made available in unlimited quantities, and the price shall also be much lower than HRIG, which is the human rabies immunoglobulin. So yes, we have this product available. We need to use it. and lots of people are using it. Some states are procuring it in good amounts, and it is there in the market for 4 or 5 years. There is another product available, similar monoclonal antibody, which is also being used across the country. And this seems to be the future in the prevention of rabies and post-exposure prophylaxis.
Okay. With that, Dr. Sai, if you want to add your thoughts to this conversation.
Actually, as from Society for Emergency Medicine on our initiative to eliminate rabies, definitely a long way is there ahead. As I told you about our ongoing efforts, adding to that, we also try to establish the adoption of newer prophylaxis for passive immunization like cocktail rabies monoclonal antibodies. As you know, rabies immunoglobulins possesses some challenges of safety and availability. So SEMI is working closely with Zydus and other manufacturers to increase the availability of those vaccines to all emergency departments, so that the primary prophylaxis is much way ahead. Along with as other speakers have mentioned, along with the government of India, we will definitely try. We will work towards eliminating rabies by 2030. That should be the goal of every clinician who's practicing to prevent the rabies from our country.
Okay. So, do you want to talk about more initiatives, highlight few initiatives for our audiences, being the vice president or the vice president of SEMI, if you'd like to add something more to it?
We have something called the SEMI mentorship program, where every emergency physician of a particular state who is working in either a private hospital or a government hospital, we form an aggregate of emergency physicians and we certify these emergency physicians on animal weight management and give them a standardized protocol, which is followed all across India on animal weight management, which includes wound washing and the passive immunization and active immunization. Already, as I told you, we are conducting these group discussion meetings, and we are even more trying to work along with the government of India to speeden up the process and conduct more meetings. And synergistically, we want to conduct many state chapter members have also been. We have about, as I told you, we have about 23 state chapters all over India. Who have about every state chapter is around 500 to 1,000 practicing emergency physicians who are heads of emergency departments in various hospitals. And we have already started to initiate many case studies and case reviews of varied dog bites and varied case scenarios. And we are also planning to release our SEMI Blue Book in this our annual conference in November in Chennai.
Okay. With that, how would you like to establish the rabies protocol in India? I would like to ask this to Dr. Anurag and Dr. Ravish too, because Dr. Sai has already spoken about this. So, how would you like to establish rabies protocol in India? Dr. Anurag, if you could talk about that.
Yeah, so again, we have been pointing out continuously that we need to spread this message across the country. So Dr. Ravish with APCRI and BA with Consortium Against Rabies are holding continuous awareness programs. We call it CMEs, continuing medical education, hands-on workshop, online support systems. We have apps, we have websites, we have email IDs, wherein we tell everybody that you have a problem, you give us a message, you give us a call, and we will tell you what to do. We will try and sort out your queries. We hold conferences, we hold CMEs across the country, and we try and inform the participants as to what to do and how to manage the fatal illness, or prevent it basically, because it cannot be managed once you have had it. Other than that, we work with NCDC, that is National Center for Disease Control, in upgrading and reviewing the guidelines. We are part of various committees in which we think of new ideas as to how to promote and promote rabies prevention. Then looking at the animal component, again, we work with veterinarians in our associations together, and we again take up sessions, we take up immunizations for veterinarians, we talk to veterinarians, we take up their ideas as to what can be done, because they are the experts in the animal component. We are we can only look after the human component. So we sit together, we exchange ideas, we have meetings, we do research also. So we do various publications again in this field, so that we ultimately want to see that what are the better ways of preventing rabies, how can we make it cost effective, what are the challenges, what does the patient feel regarding the immunization, what is his out of pocket expenses, are there any better ways of preventing this disease. So all this goes on through our associations, and there is a lot of exchange of ideas. We sit with policymakers, we try and influence the government, we talk to politicians, health ministers, we push them into providing funds and supporting this program across the country. So these are the various initiatives taken by associations, doctors associations, in trying and preventing this dreaded illness. Thank you, Dr. Ravish.
Thank you. And as I have already told you, Government of India under NCDC has already implemented NAPRI, which is a big move towards elimination of rabies by 2030. And the government has also given guidelines with regards to SAPRI, which is a state action plan. Each state has to have their own action plan depending upon what is feasible for them. So implementation of SAPRI plays a major role in, of course, definitely elimination of rabies in our country. So mostly the most important thing which I've already covered previously, which is with regards to the training. Regular training has to be done for all the doctors from the government. We are focusing on the government work. Is your question on the government's role or ours role also, APCRI role also?
Your role as well, APCRI roles as well. Yeah.
And of course. Yeah, of course. The APCRI always collaborates with everybody, starting from World Health Organization. We have done 2 major studies across the country funded by WHO. We are collaborating with Government of India, NCDC. We are a part of meetings with regards to NAPRI, SAPRI, and all those things. And of course, as all of us know, that APCRI is a premier organization started more than 25 years back and working towards elimination of rabies in India. Taking to one by one with regards to the training program of the doctors, especially the healthcare professionals, it's very important. IPCRI, along with NCDC, with the support of NCDC and others, we are doing regular training program. We are also conducting training program to doctors on the eve of World Rabies Day, which comes in on every September 28th. And of course, as Agarwal sir has told, with regards to workshops, CMEs, and conferences are done across the country. APCR has covered almost all the states in the country with regards to the CMEs and conferences. And we are a part of advocacy team. And thanks to once again NCDC, they have invited APCRI as an part of advocacy, which tells you regarding the SAPRI or the implementation of state action plan with regards to rabies elimination. There, the focus is mainly once again on practice or training of healthcare providers, giving community awareness, which has to be done at the field level and which can be done through the associations. Then making available the drugs, which are the anti-rabies vaccines, and also the supply of rabies immunoglobulins and monoclonal antibodies wherever it is necessary, and it has to go to the ground level. That is, till the primary health center level it has to reach. Those things has to be done, and we are in pipeline, and of course the government of India is also doing. From APCRI, we are also supporting them in implementing all these things. We are ready to train everywhere or anywhere. Whenever anybody calls, APCRI is always ready. And they need not worry, APCRI will bear all the costs. We will only come at your doorsteps and give the training, any state or any district. That is the motto of our APCRI. And of course, creating public health awareness is a challenge which has to be taken by everybody across the country, whether it is a doctor or whether it is from the pharmaceutical company or from the political background. They are supposed to do it. Once the political advocacy comes into picture, everything will go on. Hope so, definitely. If we implement everything and these challenges are met, definitely we can see the light. And I still remember 5 years back, Dr. Bernadette Abela Ritter, who is presently and at that time also who is the in charge or the head of the National Neglected Tropical Diseases at WHO, who told this is the generation, or within 1 decade, we have to see zero rabies. That has been implemented now. So we have to work towards it, and we can definitely do it if we follow all these things. Thank you.
Thank you, Dr. Ravish, for sharing what exactly is APCRI doing to establish the rabies protocol in India. So thank you so much for doing that. So before ending this insightful session and segment, if anyone of you would like to add something to this discussion, that will be just great.
I would like to suggest both Anurag's sir as well as Dr. Ravi sir. You being the two main bodies working on rabies, I'm member of both of them, incidentally. Few years, maybe many years back, we had a CD series from rabies in Asia, where we have one from professionals, one for the general public. If both organizations collectively or individually come up with videos for, especially if I talk about the school children in multilingual aspects, because they are the most vulnerable population, and we get maximum cases from among the younger population. So if you come with small videos in local languages, and that can be shown through the school education departments, and so that we have awareness among them. Secondly, another important aspect where we need a policy decision by the government. If we have vaccines against 12 diseases being given under universal immunization program across the country, why rabies immunization cannot be part of UIP now? Because if we look at the mortality and morbidity due to animal bites among children and the deaths consequent to those, why not rabies should be part of the immunization program? I suggest, and I would request both of you, if you take this with the government to include, because it has been happening in many countries now, that rabies is part of the immunization schedule being given to the young population. So if that is taken care of, I believe we will save many young children from getting rabies later on.
Yeah,
Thank
as
you, sir.
exactly. Yeah, thank you. Thank you. Dr.
Can I?
Yeah,
Can
yeah,
I?
sure, please. Yeah, please go on.
Sir, thanks for both the things. We will definitely do it. From APCRI side, I'll definitely tell you that we are, or we will, going to do the video for young children, which can be shown in the school. A short video, we will do it, sir. Definitely, we will circulate among everybody. It will be there on our website. Even today, our website contains few important educational videos for general public and doctors, as Salim sir has already mentioned. We will do it for pediatric age group also. That is one thing. The second thing is regarding implementation of anti-rabies vaccine as a part of UIP. That also we are planning. Whenever there is a chance, we are going to meet the health minister. You know, in our Delhi conference, at that time also, Dr. JP Nadda was the health minister when we did in Delhi. We called him to our conference. He was gracious to come to our conference. He was the chief guest in our conference. And after that, lot of things have moved. You know that the NRCP came, NAPRE came, SAPRI came, everything came. So this time also we'll try to move. Whenever there is a chance, we'll meet. Once again, Nadda ji has become the health minister now. We'll try to focus on that, and we'll try to show them that this is an important preventable disease, and we are supposed to make it 0 by 30. And we'll try to go with the government for advocacy and implementation under UIP. Thank you.
So I'll just also add a few lines. So in pediatrics, because I'm a pediatrician by profession as such, we have some modules for school children, and that module is basically meant for emergencies, how what emergencies children should handle and how to handle it. So in that we have a 3 or 4 slide package on how to handle an animal bite. See, general public requires just 3 or 4 basic information which they have to do, and remaining is of course going to the doctor. So that part we are already doing across the country, and we have a module for it, and prevention of rabies is a subset of that module, emergency in schools we call it. And yes, we made some slides for government schools of Delhi separately, and we have circulated it through them. We have a small awareness slide set for general public on our website. These are there, and talking about pre-exposure prophylaxis, it's a big step. So we have to understand that our immunization schedule is already loaded with lots of vaccines. And pushing a rabies vaccine in it, yes, we have had multiple meetings, Consortium Against Rabies with NCDC, with the Director General and the Minister also, and members of Niti Aayog. And we have tried to push pre-exposure prophylaxis into the immunization schedule, but a space has to be created for it. After that, we need to have a pilot for it in the country. So these are technical discussions which are going on, and maybe in a few years you will be able to see this vaccine being introduced into the schedule. See, multiple technical parameters have to be looked at. So we are still working them up, and let's hope we are successful in bringing it into our schedule. But having said that, Indian Academy of Pediatrics and Consortium Against Rabies both actively support pre-exposure prophylaxis, especially in children, because they are the most vulnerable, and protecting them will imply that they'll be protected for life. So if you immunize a child who's 2-year-old, he'll be protected for like 60, 70 years, as compared to an adult who will have lesser years of life. So yes, we are pushing it, and let's hope we are able to be successful in doing it. Thank you.
Thank you,
Yes,
sir.
Doctor.
If we look at the immunization schedule over last 1 decade, we see around 5 to 6 vaccines have been added, and they are already around a dozen more in your immunization schedule being used. So it won't be difficult to ask the government and influence them. If you look at their TB control, TB elimination, under SDG, it's 2030, but country is going for 2025, and now they are starting with the adult BCG vaccination. So if both the organization are being would influence NADA, sir, this time I believe this could be a positive thing to happen.
We will do that, definitely. Thank you. It's an ongoing discussion, and lots of loopholes, problems, and discussions and issues need sorting out.
First, Dr. Manna, you wanted to say something?
Yeah. I just want to mention in few seconds that at the implementation level, at the periphery, dogs and other animals don't look at the calendar, whether it is a holiday, or to the clock, whether it is not the office time or OPD time. It is an emergency. So, implementation and establishment of model anti-rabies clinic and availability of the first dose of vaccine, wound care, as well as the immunoglobulin or that monoclonal antibody, whatever it is, that should be available even at the peripheral level 24/7. That is one important point. I have seen many health institutions, private, even government, where for 24 hours this service is not available. Patients are told to come at the OPD time or to bring their Aadhaar card or identity card next day so that the vaccine would be given. Mind that rabies virus progress very fast through the neurons. So it should be halted at the earliest opportunity to prevent that disease. That's all. Thank you.
Thank you all for joining us today as we explored critical insights to put Viram on rabies, this World Zoonoses Day. So as we conclude this session, this segment, let's remember the importance of awareness, timely treatment, and collaborate efforts in combating this preventable yet deadly disease. So stay informed and stay safe. Thank you so much for joining.
Thank you.
Thank you so much. Bye.